Unfortunately, for people that have been brain injured, the road to recovery can be quite long. Sometimes they'll need surgery right away, which of course, recovering from brain surgery is a completely different bag of wax altogether. But oftentimes, most of the time really, brain surgery is not really needed. In those times, the recovery can be just as long or even longer than those that actually go through the brain surgery. The recovery can involve speech therapy, can involve physical therapy, can involve cognitive therapy, it can involve vocational therapy, meaning to learn how to do a job or to relearn how to do the job they once had before they were injured. It can involve many other therapies, medications, what we call brain games, where it's just simply getting the brain back into the pattern of recognizing various patterns or mathematical equations and being able to process that information appropriately. So the road to recovery, it isn't a week, a month, oftentimes not even a year before the person's back to where they were, assuming they can get all the way back. In fact, it's been estimated, and there are studies out there that would indicate that 10% of mild traumatic brain injuries are permanent in nature, that 66% of moderate traumatic brain injuries are permanent in nature, and that 100% of severe traumatic brain injuries have some permanency to them. Here we see an imaging study of a brain that has a permanent area where it is now dead, to be honest with you. If you look at that dark area with the arrow on the lower left side of the brain, that's actually an area that was once gray matter as we see in the rest of the brain scan, but unfortunately, because of some bleeding that took place as a result of the injury, that area is now dead. There's nothing left there, and of course the information that area was designed and had been processing through this person's life is no longer viable, no longer processes that information, and it's left that person with severe deficits, unfortunately, that are going to last the rest of their life as the brain doesn't regenerate with time. So the outcome of a brain injury depends on a multitude of factors. It depends not only on the type of brain injury it is, but the area of the brain that's injured, whether there's bleeding or swelling involved, whether there's ongoing risk of bleeding, such as stroke involved, the age of the patient. Both children and those over the age of 65 are particularly vulnerable to a permanent brain injury, more severe than the rest of the population. It also honestly depends on the person's desire and will to get back, their family support, their other social support, the ability for them to access the appropriate physical therapy and other therapies in a timely manner. And unfortunately, that has to do a lot with their finances and the ability to get the needed care that they're required to get. And if people are uninsured, don't have the proper assets, you have someone who caused a brain injury not willing to step up and pay for the damages, it can cause long-standing, severe, and ultimately permanent effects on the patient.